Dr. Harry Croft is a private practice psychiatrist from San Antonio who is triple board certified in adult psychiatry, addiction medicine, and sex therapy. In addition to 35 years of private practice, he has, for the past 25 years, served as a medical director of the Psychiatric Research Center, where he has been principal investigator in over 60 clinical trials. He has published many articles in major journals, including JAMA, Psychiatric Annals, American Journal of OBGYN, and others. He's served in the Army Medical Corps as the Psychiatric Director of the Drug and Alcohol Program. He has now evaluated more than 7,000 veterans with PTSD and is the author of the popular new book for veterans and family members on PTSD, I Always Sit with My Back to the Wall. He is a recognized expert on PTSD, having been interviewed on such national media as CNN Worldwide, Fox News, Bloomberg, MSNBC, the Associated Press, Houston Chronicle, Army Times, and others. He has lectured to over 1,000 groups of physicians and mental health professionals in all 50 states and 7 foreign countries. He is the recipient of many state, local, and national awards. Yet he lists his proudest accomplishment as his 47-year marriage, his 2 children, and 2 granddaughters. Ladies and gentlemen, Dr. Harry Croft.
I want to start by thanking you for allowing me to talk to you today about a very important subject about which I'm very passionate, post-traumatic stress disorder in veterans, especially in terms of combat veterans, for primary care physicians in the civilian community. This talk is probably going to be a little bit different than most of the continuing medical education talks you've been to throughout your career. Frankly, it's a lot different than most of the CME talks that I've delivered over the last 25 years. Although I propose to give to you useful, up-to-date, and scientifically correct information, I won't be presenting you any of the background studies. I won't be showing you any graphs. I won't be talking about the statistically significant differences in this talk. In fact, there's not even a need for you to take notes. I'll give you all of the information at the end of the talk. It will be available to you. So what I hope you'll do instead is just kind of sit back and listen as we go through this journey about this important topic of PTSD for the primary care physician. Before I begin, I have to give you the disclaimer. These are the pharmaceutical companies that I've received speaking or consulting or research honoraria from throughout the years. We're going to start with the CME questions. I'll give you the answers to all of these questions during this talk. 1, according to a recent RAND report, the percentage of troops returning from deployment to Iraq and Afghanistan suffering from PTSD is approximately 5%, 10%, 20%, or 40%. Frequent co-occurring disorders with PTSD include all but which of the following? A, substance abuse disorders, B, major depressive disorder, C, bipolar disorder, or D, generalized anxiety disorder. Question number 3. The core symptoms of PTSD include all but which of the following? A, unwanted thoughts, nightmares, or flashbacks. B, hypersomnia. C, being easily startled. Or D, social withdrawal. Number 4, which of the following describes the evidence-based treatments shown to help those with PTSD? A, SSRIs, B, exposure and/or cognitive-based psychotherapy, C, benzodiazepines, D, A and B, or E, A, B, and C. 5, surveys have shown that those with PTSD are more likely to have trouble with A, relationships, B, employment, C, cardiovascular system issues and problems, and D, A and B, or E, A, B, and C. Again, We'll give you all the answers as we go along. The learning objectives for this talk. 1, learn common presenting symptoms to civilian primary care physicians of those with combat-related PTSD. Number 2, understand the importance of treating combat-related PTSD in addition to relieving the obvious presenting symptoms. Number 3, be exposed to common misconceptions as well as facts regarding PTSD. Number 4, be exposed to current evidence-based treatments for PTSD. And 5, become familiar with common co-occurring conditions in those with PTSD. Why should you, as a civilian primary care doctor, even care about PTSD? 1, because these vets are suffering. And 2, those who care for and about them are suffering as well. Let me give you a flavor of what it's like to have PTSD. The clip I'm going to show you is from Lieutenant Lee Alley, one of the most decorated Vietnam veterans, receiving the Distinguished Service Cross and co-author of the book Back from War. Listen as Lee describes one of his experiences.
To do that, I'm going to take you back a few years. It is so dark, and yet even in this darkness, the light from the moon casts shadows, and as I look at those shadows, is that movement of the enemy or are my eyes betraying me? I can feel the enemy. I know they're there. They're just beyond the grove of banana trees in front of my defensive position. I can feel them. My arms begin to tingle and the hair on my neck begins to stand, and I said, I can feel them. There. I can smell them. My senses have become so keen that I can smell the enemy. I can smell the nook mom, which was the drippings and fermented drippings of the rotted fish that they put on their rice. I can smell them and I can feel them. It's as if two warriors, they are on this side and I am on this side, and we are preparing to battle. And as I look down the line at my men, I commanded a reconnaissance platoon of 35 hand-picked men. And as I looked at them, my mind said, who will survive the night? They are warriors and we were warriors. Somebody is not going to survive the night. My thoughts were suddenly brought back to instant reality as I heard the thump of the mortars as they left the tubes. The mortar attack had begun. Once the attack began, it was an all-out frontal attack. There must have been at least 200 of them as they came upon my defensive position of my 35 men. And then the silence is broken by the screams. And as the Viet Cong yelled, GI, you died. GI, we will kill you tonight. And then my body is soaking wet. My body is wet, and as I touch my body, it's the blood. I look to my left, my radio man is shot through the head. I look to my right, my other radio man is shot right through the chest. And oh my God, I am soaking wet and I can't get the blood off of me. And the sounds and the smells. And then just as sudden, it's over. It's quiet. Because you see, that battle wasn't 40 years ago. That battle could have been 2 nights ago. And that battle wasn't in Vietnam. That battle was in the comfort of my own bedroom where I should be secure.
Can you imagine 30 years worth of nightmares in a place that he believes he's safe and that his wife and family members believe he's safe? That's just a flavor of PTSD. We'll talk more about that. So why should you, as a civilian primary care physician, even care? Not only are these vets suffering and those around them suffering, but also you can make a difference. And they're probably in your practice anyhow. You just may not know it. I'll tell you why, and I'll tell you how to help as we go along. Let me start back in 1973. I come into the U.S. Army Medical Corps as a major. I'm in charge of the Army's drug and alcohol program at Fort Sam Houston. It was Nixon's showcase program to the world. Vietnam ended in 1975. Tragically, in 1973, we never wanted for somebody to fill our beds. They were always full, the drug and alcohol beds. And all of the people that I saw, all of the soldiers I saw, had what we would now call PTSD, but PTSD had no name. In 1973, didn't get its name till 1980. But more importantly, we didn't know what to do for these soldiers as well. So what I did is what I was told to do by those above me. I gave useless advice. I said things like, stop smoking all that dope. Stop drinking so much. Stop being angry all the time. Get a family, get a job, get a grip, get a life. All of which was just useless. And I'm sure they thought, he not only doesn't get it, he doesn't care. But I did care back in the early 70s, and I do care now. And so as a result of that caring, 14 years ago, I got the opportunity to start evaluating veterans for disability. I've now seen 7,000 vets over the last 14 years with PTSD. And because of my interest, in addition to getting the information I needed for my report, I actually listened to what they had to say. And for the first time in many, many years and decades, many of them first opened up to me about stuff they had held inside for all those years. And so did their family members, many of whom were sitting with them. And I started writing a little manuscript to help them out, and the veterans would say, how did you know me? After they read the manuscript. And I said, well, I didn't know you when I wrote that, but I do know about PTSD, and that's what you have. Out of that little manuscript came this book that I wrote with my co-author, Chris Parker, who is a civilian chaplain and trauma expert who actually spent a month in Iraq back last year. And we wrote this book, I Always Sit with My Back to the Wall. Those of you with PTSD or have patients with PTSD will understand the title.